Hi there, I'm Dr. Benfield, I'm a GP, and this video looks at how you control your hay fever better, particularly important for people who also have asthma, as controlling hay fever is really important to reduce the risk of asthma attacks. There are three main types of treatment for hay fever. There's antihistamine tablets, nasal steroid sprays, and anti-allergy eye drops. Two common antihistamine tablets are cetirizine 10 milligrams and fexofenadine 120 milligrams. When you buy these from the pharmacist, they are once a day medications. As GPs, we could prescribe them as twice a day if your hay fever was not well enough controlled. Usually avoid Piriton, as it's more likely to cause drowsiness than the others, and it usually only lasts for a few hours. There are two common brands out there of nasal spray, and they're Beckinase and Nasonex. It can take at least 4 weeks for them to reach full effect, so aim to start them a few weeks before you expect the hay fever to start. Maybe set an alert to remind you to start them, say mid-March, for example. Your aim is to use the lowest dose that works, so you might start them at, say, 2 puffs to both nostrils twice a day, and then as symptoms are well controlled, you gradually reduce down, and then you maintain it at 1 puff once a day, but you can always whack that dose up quickly if ever you get a hay fever flare. There's another brand called Dymista, and this contains some antihistamine as well as steroid, and I've been told that it works quite quickly compared to the other ones, so if suddenly your hay fever is bad, you might want to go on to this one rather than the more slowly acting others. The third thing is the anti-allergy eye drops, and the commonest medication is called chromoglycate, and it's found in a few brands you can get from the chemist. Check with the pharmacist what you're buying contains this or something equivalent, as there's lots of eye drops out there that are soothing but not really anti-allergy. You apply 1 drop to both eyes, and you can do that up to 4 times a day as required for your symptoms. There's also a few non-medical ways to reduce your hay fever on high pollen days, such as wearing sunglasses when you're out, having a shower when you get back in to wash the pollen out of your hair and off your skin, keeping your windows and doors shut, and don't dry your clothes outside. If you're still suffering from hay fever symptoms despite all of this, contact the GP practice and bring in or have photos of the medications you are currently using. Okay, thank you for watching.